Oh, lovely. I see we have Jose joining us as well. That's excellent.
Okay. Okay, I think we can start. Okay. So, hello everyone, and welcome to this EPAG webinar about ERN and EpiCare. I introduce very briefly myself. I am Isabella Brambilla, the coordinator and representative of patients in ERN EpiCare group, and I am been delegating for 16 years about Dravet syndromes and rare and complex epilepsies. I would like first to thank our ERN coordinator, Alexis Atsimagoglu, and the staff for their collaboration and support for this webinar. Today, the goal is to introduce you to the structure of ERN and the central role of patients and the activity of our group within EpiCARE network. But before that we start, we prepare a very short poll to know who joined the meeting today. So if you look at the chat, you find, maybe you see on the video is a very short poll. We want to know where are you from, because join different people for different country, and you can submit that. We have maybe 1 minute for answer. We have a second poll, or? Okay, the result is, Europe, 87%. We have people from North America, South America, and and also, I think, most of all from Europe. Perfect. Okay, we have another poll about, have you heard about European reference networks and European patients advocacy group before? So yes or no? Okay, good. 83% know about EPAG. Is a surprise, fortunately. So only 70% know. Okay, another question. Are you member of EPAG EpiCare? Because today join also the community of EpiCare. We want to know how many join us as EPAG representative, or no, at the moment, no patient representative. Okay. No, 71% and 29 yes. Okay. Thank you. Maybe the last one, are you an EPAG member of other ERN? Because we have a lot of ERN and a lot of disease as transversal for different ERN. Maybe you are a member for EPAG for another specific ERN. So look at the answer. Okay, 12 are member, Ithaca or R&D, perfect, and 88% no member for the ERN. Okay, maybe it was the last question, if I remember well. Okay, thank you. So we know a little bit about the audience today. Okay, I will present very short the program that we have today. Is the introduction. We have the pleasure to have with us Anne Law, is EPAG manager at EURORDIS, and she will present the role of the structure of ERN and the role of EPAG for European patient advocacy group, but for EURORDIS point of view. We will have Alison Watson, is my co-chair in ERN EpiCARE, and she will present a little bit more about the activity and the value of the EPAG internal of the group EpiCARE. And also we will have with us EPAG representative, Nott, that give us an overview of the value of the EPAG for the physician point of view. And then we will have question and answer for you. Please be active, ask, make your question, and we are here for answer and to try to involve you in our activity because it's part of our patient perspective, and it is very important for us to have also your opinion and your questions. Before that we start, I want to tell you that ERN are the network of research centers in Europe specific for rare disease, but the design of the structure put the patient in activity rules, but the center of all structure of ERN. And I think it's the big change for this project that never seen before, to put the patient in the center of all activity. And next slide, please. With ERN, we are touching and also improve us to collaborate and about the different disease, also syndrome that have something similar, but also with different activity and different problem, but also with a lot of common needs. I think it also another big change in terms of analysis of rare disease, not only the single disease as was organized before, but the group of similar disease. Our ERN involve all rare and complex epilepsies, and the role of patient is not thinking about the single disease, but have also a mission to look at all rare and complex epilepsies, what we have in common and how we can resolve some questions together. I am very proud of the group that we have created with this item and the contribution that always try to make in the various working group, all patients involved. I thank you really, my team, for the great teamwork, because it was a big change also for us to try to represent not only ourselves and our disease, but be really a reference for all patients with rare and complex epilepsy. So I think we organize ourselves to a big change to analyze it, to understand more the other disease. In general, I think it's very important for the patients to try to stay in a network that start usually from idea, from some researcher, from some project, from some understanding more the rare and complex epilepsies, how we can have a global vision and how we can put the resource all together. Patient, physician, researcher, not only in Europe, but sometimes also collecting people in all the world to be a common community that search and find a result for our patients and our families. Which are the benefits of this organization? Which is the benefit that the patients can make and when they working together with a great community? The benefit is create a network for support the families and the patients. But also our goal is all of us want to have a cure, but it's not possible for all at the moment, but improve the quality of life. I think it's something that it's necessary for us to achieve in any case. And share activities, socialization and experience, I think is something that we need to take care to achieve this goal. And the opportunity that we can reach in is very important to cooperate and to working together for resolve the problem of the unmet need, but also the health support that and the structure that we need for rare and complex epilepsy. The benefit for research is sure to acquiring deeper knowledge of the syndrome and its aspect, improving data collection, and optimizing, if it's possible, research and results. What we can do for unmet needs? Sure, it's very necessary to work all together because everyone has different perspective, but as patient, we need to maintain the attention of our goal. Our goal is, as I said before, is a cure, but also a quality of life. So when we spoke together with all patients, we discovered that one of the main questions that we want to solve with a group of ERN is define an early diagnosis and to find out the best treatment option possible at the moment. Maintain and support research and working, if it's possible, with pharma company to define new drugs, if it's possible, but in the future, new cure. Specialists qualifying, we need to define what we need exactly. It's not only for physician and for drugs question, it's also how we can achieve the goal to a greater rehabilitation problem and how we can achieve the goal to looking more on the comorbidity. And also we need to support the family and caregiver and have the need to put the attention for the healthcare system, which are our needs and how they can help us to have more support for our need for us and for our children. So the role of patient in this project is really central of the attention, because sometimes we need to remember that which are the impact of the disease for a family or for a patient, and to try to analyze global care for the patient and not only a single perspective. In this case, and especially in ERN, data, registry, survey, information about daily life, awareness, knowledge, is something that is very important to add it and the other clinical and research information to achieve this goal altogether and to are able to receive some information that can help us how we are able to manage the disease in the single country with our healthcare system. So patient and caregiver with the association are very active roles. We have a lot of physicians, researchers that can help us in EpiCare. The pharma company is in the future something that we need to involve. And also the social care system is something that in every country we have different social care, but we need to activate in a correct way to help for rare disease to have the social care that we needed. So working together for me is definitive the best care and cure for rare disease to make the better quality of life possible. And I think for the future with this structure with ERN, maybe something more possible than in the past. So I am very happy to be part of this new family, and I hope that with the work and involvement of all patients, we can finally put the attention in the correct way. Okay, this was an overview what we want to achieve with this for the patient perspective. But before that we start, I have some information for you. If you see you are muted at the moment, but if you have a comment, we invite you to comment and question. If you see under the screen, you have a chat box and you can put your question here if you want, or you can raise your hand. If you click in participation, you can also raise your hand and we can unmute you and give the voice to present your question. There is the chat box, and if you have any comment or question that for the speaker, at the end, as I say in the program, we have also opportunity to have specific some question and answer, but please note your question before you forget, because the presentation sometimes have a lot of input. The webinar will be recorded and will be available on demand. And then after, if you want, you can receive the presentation as well. So, okay, today we have the pleasure to have with us, and I will to present and give the voice to Nott. She is our mentor for EURORDIS, and she following our process. So we are very happy to have Nott with us. That is our driving us in the correct way, and it's a very important opinion and vision that she have for the community of EPAGs. Thank you, Nott.
Thank you very much, Isabella, for this nice introduction. Good afternoon, everyone, and thank you for joining. So I'm going to give you today a little bit of an overview of what are the European reference networks, although we saw from the poll that the majority of all of you know a little bit about these networks, but it's still good to refresh a little bit and to remind what all these networks are. A second point will be the role of the EPAG advocates and the role, of course, of the EPAG community. So what could be your contribution to these networks? And finally, what is the role of EURORDIS supporting these groups? Next one, please. So introduction to the ERNs. Next one. So you probably know that, of course, the majority of people living with the rare disease face many changes and challenges that affect many aspects of their life and their health. These challenges are very critical, and for instance, there are difficulties in finding the right clinical expert, or to get a correct diagnosis, or to access appropriate treatments. So also patients and experts are also often isolated. So all in all, it makes their life even more complicated. Next one. So in response to these challenges, the European Commission created in 2017 European reference networks, because they realized that one country alone couldn't basically tackle all these challenges. So they created 24 ERNs. So you can see the list at the right of the screen. They were launched in 2017. They are virtual networks that connect 800 expert centers in 300 hospitals in 26 European member states. They are grouping in different thematic disease areas, as you can see again on the list. They cover a very range of different condition, disorders, and syndrome. For instance, rare bone or rare cancer, of course, rare and complex epilepsy, so EpiCARE, that we present today, transplantation in children, etc., vascular diseases. So they really cover a very large range of rare diseases. The main objective is to facilitate access to diagnosis, treatment, and to provide high quality and cost-effective healthcare. So in other words, to improve the quality of care of the patients living with rare diseases. All these networks are governed by a network board, and they are EPAG advocates, so patient representatives in each of these boards. So at the same time, when the European Commission was creating these networks, EURORDIS created 24 European patient advocacy groups. It was in fact before the launch, so in 2016. Each of the EPAG correspond to one ERN thematic disease. That's why there are also 24 EPAGs. So, and really the goal was to bring the patients at the table and at the center of the networks and at the center of the discussion. Next one, please. So basically the rationale behind the creation of these networks is that the expertise will travel and not the patient. So a patient, for instance, with a rare and complex disease or syndrome will visit his or her medical doctor in one of the national healthcare provider, one of the expert center, which is part of, or which will be connected to one of the ERN specific to this particular disease. And the expert, for instance, if they need a second opinion or if they need to ask an advice, will use a virtual healthcare system that's called the CPMS, Clinical Patient Management System, to ask for another advice from another specialist located in another medical center in Europe. So all these centers and all these experts are connected via this platform. The networks, just to give you an example, they work on very different type of activities. They basically share experience and expertise. They provide training and they develop clinical practice guidelines as well. They have started to work on collaborative research projects and clinical trials. So this is something that that will be for perhaps in the future a little bit more developed and common. And so in the end, these networks are European infrastructure for knowledge sharing and knowledge dissemination. So the idea in the end is to transfer this knowledge from the ERN, from the network, to the national local medical centers. Next one, please. Here I'll just give you some useful resources and links, so you can take a look at the ERN webpage, the list of the 24, and some of animation and video clips made by the European Commission. So you also can see the point of view, the presentation from the health professionals and from the patients too. Next one, please. So the role of the EPAG advocates, and of course the role of the EPAG community. Next one. So first, so for you to understand why are patient representatives involved in the ERNs. So the ERN, the EPAG advocates, so patient representatives are invited members. They are not legally, officially part of the networks, but they have been invited to join the networks, to join the working groups, to join the activities, and to also join the ERN board, because they recognize, it has been recognized that they are a resource for the ERNs, and of course, they have been recognized as a very important piece of activities of having patients on board. So the EPAG advocates have, of course, a unique knowledge and personal experience of living with a rare disease or caring someone with a rare disease. The experience is really important and recognized, but what is really important to understand as well is that their legitimacy really starts as a patient representative when they are able to engage with their community, so with their patient community, so with you, with the local patient organization, with the patient and family, to understand their needs and to bring their needs to the table, to bring their needs also to the discussion with the clinicians in the networks. So really, what is really important in the end are the needs of the wider patient community, so your needs basically. And on top of that, of course, they have also they have an holistic view, so they bring really a nice approach, and they know all the healthcare process, and they also bring different expertise and skills, which is most of the time outside the clinical, the medical and research field. Next one. How the EPAG are organized. So here you have this kind of picture, so you understand that there are 24 EPAGs, as I said at the beginning. Each EPAG group is working with one ERN and is composed of EPAG advocates. So again, patient representatives that represent different patient organizations in Europe. We've got now around 300 people who are active in the network activity. And in addition to these people, we have the EPAG community. So these are more than 1,000 patient organizations. They are based in Europe. And for any reason, because they don't have the resources or because they don't have the time or the interest at that moment to be actively involved in the network, but they still want to keep track on what's going on in the ERNs. So they want to be informed. They want to be consulted from time to time. So they can join the EPAG community, but they don't have a patient representatives. So in this community, as you can see, is very huge, and we haven't started really to actively engage, but some of the ERNs and the EPAG have started to engage with them. Some of them, for instance, have sent survey on research priority to get their needs on research, others on patient development, on patient journey. This is, by the way, the case of EpiCARE. And of course, today we have this webinar to introduce what the EpiCARE is and to get to know a little bit the future patient community. Next one. Just for you to understand the role, the mission and the role of the EPAG advocate. So they represent the interests and the voice of the wider patient community. They work in partnership with the clinicians and the researchers. So in a way, they are this bridge between the ERN and the wider patient community. And they work on a very different kind of activities, such as registries, clinical practice guidelines, surveys, patient information. Some of them have also a kind of leadership role in the decision-making process when they sit on the network board. And if you are more interested, if you have some interest in looking to a little bit more specific information and recruitment of the EPAG advocates, you can take a look at the EPAG Constitution, which is the link is in the slide. Next one. The EPAG community, so in terms of mission and role, as I said before, the EPAG community is a group of patient organization members and non-members of EURORDIS. They are established in Europe, and they have requested to join the group at some point to follow the work of one or several ERNs. They are not actively involved in the internal network activities, as I said, but they are active within their patient community, and they communicate, they engage, and they consult externally to the ERN via the EPAG advocates. So for instance, they can communicate and disseminate the ERN activities, what they did, what they are doing, ensure feedback on patient experience in the development of guidelines and patient journey. They can respond to survey. They can also promote participation of the patient community in the ERN's activity. And Alison will give you a little bit more of details on what could be also example of activities for you in EpiCARE. Next one. So how to join? And I know there is a question on the chat. So joining an EPAG community is open to all patient organizations that want to be active and engage with one of the ERNs. And they have to meet the following criteria. So to represent rare disease that belong to the scope of the ERN, to act in the interest of a specific rare disease community, and to be registered and operating in Europe. So if you want to join the EpiCARE community, you can contact me, you have my email address, or you can directly complete this short registration form and add one contact person, and we will contact you back. The thing is, we know that some of you are not part of Europe, have based outside Europe. So if you are still interested, of course, to be involved at some point and to get in touch with the EpiCARE ePAG and ERN, you can contact me or Alison or Isabella, and we will of course see how best we can collaborate and see in your contribution in the group. Next one, please. Thank you. I'm just finishing, next one, with the role of EURORDIS to understand the support. So EURORDIS is the European Alliance or Rare Disease Patient Organization in Europe. And we've been supporting the creation of the 24 EPAGs since the very beginning. We provide EPAG some tools and training. We support them also in the recruitment of new EPAG advocates and new EPAG community members. We provide technical expertise. We also provide capacity building program for patient representatives and wider community. And we also engage with the national alliances and European Federation, including also the wider patient community. Next one, please. I just give you here some useful resources that you also can take a look at the EPAG section, and good practices, also some example of what the EPAG advocates are doing within the scope of the ERN. Thank you very much. Thank you.
Thank you, Anlo, for this fantastic overview of ERNs, also EURORDIS rule. It was a fantastic for patients, really, to put the attention of the patient with the EPAG. I think EURORDIS make a great successful with this action. And thank you for all of your view. I would like to invite Alison now to present in detail what we do as patient for ERN, our advocates, and overview of the activity in these 3 years that the ERN start, and we are involved at more or less at the beginning. So Alison, please.
Thank you very much, Isabella, and thank you, Anne-Laure. So I'm going to tell you a little bit about what EpiCARE is, what it does, what we do, and how you can contribute. So we've already heard that EpiCARE is one of the 24 reference networks, and it's there specifically for rare and complex epilepsies. So you may have noticed ERN RND, which is for the rare neurodevelopmental diseases. So this has been EpiCARE has specifically called out for rare and complex epilepsies as specific rare diseases in their own rights, as opposed to epilepsy in general, which is one of the most common neurological diseases. EpiCare's vision then is to develop and deliver highly specialised diagnostics and care to improve diagnosis and outcomes in individuals with rare and complex epilepsies. That's quite a vision, but I think it's quite exciting. EpiCARE comprises 28 full member centres and 15 affiliated centres that span 24 countries across Europe, which you can see on the map here. So it's quite expansive. There is a call that has been ongoing throughout this year, and we anticipate that several new member EpiCARE centres will join the reference network later this year. Every reference network divides their work by themes, and these themes are typically referred to as work packages. In EpiCare's case, they have divided their work packages into two sets of vertical themes, so themes surrounding diagnosis and diagnostic tools, such as on the left-hand side, the laboratory and genetic diagnostics, neuroimaging, MRI, neurophysiology, EEGs, neuropsychology and neuropathology. And then on the right-hand side, a set of therapeutic models looking at treatments and therapies. So looking at targeted medical therapies, epilepsy surgery, treatments for neonates and ketogenic diet. Alongside all of this are some transversal work packages. We have the database, which is the creation of a patient registry for the rare and complex epilepsies across the whole of Europe. The guidelines, education and training, research and clinical trials. And I'll tell you a little bit more about these. And overarching all of that is network coordination and dissemination around promotion of the reference network itself. So as a patient, how do you get referred to the EpiCARE ERN? So every ERN develops a healthcare pathway, and this is the pathway within EpiCARE. So as a patient, when you are diagnosed and when you're treated for your epilepsy, you'll usually go initially through your general practitioner, who will refer you to a local or regional epilepsy centre for your treatment and care. If additional support is required, your local centre, your local hospital, is able to refer you to your national EpiCARE centre or one of your national EpiCARE centres, the one closest to you. If there's not one within your country, then you will be signposted to an affiliated centre with which there is a cross-border affiliation. EpiCARE centres are devised such that they comprise multidisciplinary teams that have the expertise to manage and care for patients with rare and complex epilepsies. But should your case be so extremely complex that even your national centre needs additional support, then your case may be referred upwards into case conference across the EpiCARE network to identify the most relevant experts in your situation. And these case discussions, as was mentioned earlier in this presentation, take place on a clinical patient management system, or CPMS. This is a tool that's used by every European reference network, where The physicians can come together and join in a virtual case conference or consultation to determine and discuss the most complex, rare and complex epilepsy cases, and to come to mutual decisions as to the next steps and to ensure the best outcomes for the particular patient being discussed. And these have been proven incredibly effective. In EpiCare's case, these case discussions meet twice a month. Once in the month, the discussions are around surgical related cases, and the second time in the month, non-surgical cases are presented. But your physicians in your national centre has to put your case forward if it feels it's necessary. So why do we have EPAG? So we've heard quite a lot about this, and we're really the bridge between the ERN, EpiCare itself, and yourselves and the patients that you represent and support out in the patient community. And what we do, our aim and objective, is to bring the patient voice to the table. We need your needs to be heard by the physicians and to drive the objectives of EpiCare itself. Who are we? Your patient advocacy group for EpiCare are presented here. There are 11 representatives led by Isabella and myself, and we represent a number of individual patient organisations in our own rights, and we come from a number of different European countries. So here's a visual representation of the epilepsies which we are affiliated with our patient organisations. But let's remember that when we put our EPAG hat on, we do not represent these epilepsies alone. We represent all of the rare and complex epilepsies. So we bring everybody's voice together. And as you can see from this map, we are actually only representing a small number of countries, those in blue, across Europe at this stage, between the EPAG core representative group and the few patient community members that we have on board today. So we have some work to do, and this is where you come in. There are 130 rare and complex epilepsies defined. Did you know that? And with 27 member states in the EU, we've got quite a lot of mileage to cover. So we'd really love so many of you to join in our community and to help us in our work to ensure that the voice of every patient across the whole of Europe is heard and their needs are met. So going back to the various work packages, what we do as EPAG representatives is ensure that we have a lead representative and a deputy assigned to each of the working groups. This means that we always have some kind of patient representation together with the doctors on every discussion group and consideration of EpiCare. In this way, we can ensure that the patient perspective is considered in every ongoing discussion. Some of the work packages are more active than others, and that's just natural progression. Isabella and I have a seat on the steering committee of EpiCare, so we actually have EPAG representation at board level, and this is really, really important in ensuring that the voice is heard. We're also involved in the Target Medical Therapies group, which is looking at 4 different rare epilepsies and has been for the last couple of years to look at more targeted solutions to treatments. There's been some ongoing work on the first suite of Orphanet updates for 15 rare and complex epilepsies that should be published fairly shortly. And then the next list of updates will be defined and taken forward by our working group. And there's lots of work ongoing on dissemination and promotion of the network and the work that's done. In addition to all of that, there's work ongoing, and this is really starting to ramp up from now on the database. So the patient registry EpiCARE were lucky to receive funding very recently to create this database, so that work will really start in earnest, although that's been happening for the last couple of years in preparation. And alongside this, one of the most active work packages has been around guidelines development, and there's 3 new guidelines coming into force fairly shortly, which includes Dravet syndrome. There is also some new work that will be starting shortly for further guidelines and consensus statement development within EpiCARE. And as many of you may have seen, this is just one of a suite of many new webinars that EpiCARE has started to present this year, typically one a month, although there are some more. These may be around specific topic areas or specific rare epilepsies themselves, mainly targeted at tertiary level neurologists and epileptologists, but they are free to register and attend on behalf of any interested party. So if you take a look at the EpiCARE website and see a webinar of interest, do feel free to sign up. And you can also watch any of these webinars at your leisure after the event, because all of them are recorded and published on the website. The most recent initiative has been the launch of work on some e-learning modules. Alongside the ILA guidelines, over the next 12 months, 10 brand new e-learning modules will be developed, and EPAG will have input into those for 10 new rare epilepsies. So some quite exciting times. But with exciting times and new work comes challenges. This is a completely new way of working, and we've all had to find new ways to develop the relationships between ourselves and the healthcare professionals that we're working with, because we're working in a new capacity. We're not working on behalf of, as a patient carer, or as on behalf of our patient organisations, which we have done in the past. We're representing this much wider community. And what we've also had to try to do is demonstrate the value, and I think Anne-Laure alluded to this earlier, of EPAG representatives in themselves. Many of us are professionals in our day-to-day lives, and we have other skills beyond the patient lived experience and patient organisation experience. We have skills in media, marketing, project management, and many, many other skills that can be of benefit to the reference networks, which are led by healthcare professionals. So we can assist in many different ways. And of course, we're very much there to ensure that that patient perspective is heard. And because that's new, sometimes that's not always easy to do. And we're trying to find the best ways to do that. This is a relationship, a partnership, and it takes time and effort on both sides. But on top of all of that, we have our own agenda as an EPAG. So I don't expect any of you to read this slide in detail, but this is our scheme of work for the next 12 months. And these are our own patient-led activities on top of the work packages. I'll just touch on a few of those very briefly. Some of you may have seen, and in the IBE newsletter, if you receive this, so the IBE represents the patient community across the world, and we've started to publish a regular article in each of the quarterly newsletters. So do look out for that, because it's some work that we'll continue to do going forwards. One of the things that we're very proud of this year is we've been doing some work on patient journeys. We started initially on the diseases that we represent specifically as a pilot, and the individual work that we did, we pulled together, and with EURORDIS' help, we mapped out the common unmet needs, those common features that existed regardless of the differences between the diseases and the syndromes that we represented. And those common needs were quite startling, actually. And we presented our findings at the EpiCARE AGM in Lyon in February this year. and that was very well received. So following that, we then went on to submit an abstract and poster at the European Congress for Rare Diseases earlier this year, which was an online conference. And we want to extend this work now, and our goal is to increase the number of patient journeys from the existing 8 to 20, at least 20 rare epilepsies. So we'll be reaching out to you as our patient community to see if you can help us develop those for your diseases. And these patient journeys we hope to represent in Rome later this year. Everything will be put on the EpiCARE website, and we'd like to present a webinar just like this one to talk you through the findings of those common unmet needs. We also presented at the AGM a new initiative that we've started on to produce some information leaflets. Again, we've started with piloting around the rare diseases we represent. And again, we would like your input to extend this out to a wider scope of the rare epilepsies. These leaflets are very high level leaflets, and we present 2 leaflets, one specifically for patients and patient carers, and the other leaflet for healthcare professionals who are not experts in the disease. And these are just very simple high level information leaflets for the newly diagnosed to signpost you to key information and where you can get further information on the specific rare disease. The graphic design for these is in process, and we hope to have these on the EpiCARE website very, very soon. So I've mentioned an event in Rome later this year. So save the date. We are hoping to have a face-to-face conference from the 17th and 19th of December, specifically for the work of EpiCARE. And as EPAG, we have a slot, a session to present some of the work that we've been doing as examples of work and collaboration between patient advocates and healthcare professionals. We hope to be able to present as many patient leaflets and also the patient journeys as poster presentations at this conference. Should the pandemic mean that we cannot have a face-to-face conference, this may well be delayed into early 2021, but we do hope it goes ahead. And finally, one of the last things that we're also involved with, EpiCARE was invited to submit create a supplement for the European Journal for Medical Genetics in November this year. And as EPAG, we have also been invited to write a paper for this supplement on the genetic epilepsies. So we're really excited to be producing a paper for this. We do hope that many of you may have seen us on social media. Hopefully we have a few of you following us on Facebook, Twitter and LinkedIn, but if you haven't found us already, do try and find us, because it's some work that we'd like to be increasing our presence on, sharing more information about the rare and complex epilepsies, and we would love to encourage conversation and participation. So do post on there and share any relevant information with that community. We'd also like to extend our patient community outreach to blogs as well. So we hope to be starting to write some blogs, and we will be inviting you guys to write some blogs for us too, so we can get some really interesting and really provocative content out there to really get the discussion going on epilepsy. So I'm going to finish off now with a call to action. We would love for you to join our patient community, and there's a link to register here, and that was also the same link that Anne-Laure shared with you earlier. Once you sign up, you will start to receive a regular newsletter, which we hope to start sending out very, very shortly. And not only will we be sharing with you the work of EpiCARE and keeping you informed, but also we will be creating lots of opportunities, we hope, for you to interact and get involved. One of our initiatives we're going to do in the early autumn is launch our first EpiCARE survey. And this will include some COVID impact questions because we want to know how you've been affected by the current pandemic. And also, as I've mentioned, opportunities to get involved to write information leaflets, patient journeys, blogs, and much, much more. And if you have any ideas and suggestions, we welcome those too. So we encourage you to get involved and get your voice heard. Thank you very much. And at that point, I'm going to hand over to Emma.
Thank you, Alison. Thank you for your fantastic overview of, in concrete, what we do at EPAG. But I would like to remember and say thank you to all physicians, because we can work with them because they involve us in any topic, in any time, and it's a great pleasure to work together, because something is not useful for them also, but they make a great job with us. And as you see, we are involved in different projects and different activity. And for this reason, Emma can give to you an overview and comment how the physician working with us, and which are the comment about our activity and involvement.
Yes, good evening.
Thank you, Emma.
Thank you, Isabella, and good evening, everyone. My name is Emma, as you can all see. I'm privileged to be a member of this EPAG group. I'm moderating this particular discussion, so I've been taking a note of all the comments and questions that have been appearing in the chat, and we'll move to a short Q&A answer session shortly. But first of all, just a couple of minutes really on what the doctors think about the EPAG. You've heard an awful lot about from us about what we do, but is our work valued by the doctors? Because if it's not, then really our work is doubled. But I'm pleased to say that we asked yesterday for some feedback from those that we work with, and I'll just take you through it shortly now. First of all, you'll see a quote there from Professor Alexis Arzamanoglu. He's the coordinator of EpiCARE. He's also the head of the Department of Pediatric Clinical Epileptology, Sleep Disorders and Functional Neurology at the Hospice Civil de Lyon in France, and he also coordinates epilepsy research in Barcelona in Spain. So a polymath, and he has an awful lot on his plate, but he says that the EPAG team for epilepsy care is a major partner of ERN EpiCARE in developing strong links with patient associations across EU countries, in helping patients and families better to understand the diagnostic complexity of rare epilepsies, and collaborating closely with all healthcare providers for the discovery of new treatments accessible to all. And alongside Alexis there, you'll see a quote from Helen Cross, who coordinates EpiCARE alongside Alexis. She is a professor of paediatric neurology. She's Prince of Wales Chair for Childhood Epilepsy at Great Ormond Street Hospital in UCL in London. And she says, EPAG enables us to have true insight into the needs of patients and their carers, as well as their perception to the optimal direction of travel. Next, we have a quote from Professor Rima Nabu, who is a professor of pediatric neurology at the Hôpital Necker Enfants Malades, and also has a role within the French Institute of Health and Medical Research. And she's also on the EpiCARE steering committee. Having members from EPAG with us in the steering committee is the ultimate guarantee to ensuring all our actions are patient-centred. Of course, that's what we're all about. EPAG members in EpiCARE are full active members, sharing their expertise and helping us to improve patient comprehensive care. And then Professor Rita Kalvainen, and I'm sorry if I mispronounced her surname, Professor of Neurology at the University of Eastern Finland and the Director of the Kuopio Epilepsy Centre at the University Hospital Kuopio in Finland. EPAG EpiCARE activity is essential to build much needed trust between patients and healthcare providers, and to increase knowledge and empowerment amongst people and families with rare epilepsies. And then finally, Anne Little is the Executive Director of the International Bureau of Epilepsy, a patient-centred organisation that works very closely with this ERN and with the ILAE. It's essential to harness the voice of the 6 million people living in Europe who are affected by epilepsy. EPAG is uniquely placed to act as a dynamic force for collaboration between the epilepsy patient and the medical field. So if that doesn't make any patient advocates out there want to join up right now and make their voice and their patient groups heard, then I don't know what will. And that brings us nicely into the question and answer session, because many of the comments actually have been picking up on this. How can we get wider representation? We've had a question from Tatiana Liakina. Is there a representative from Lithuania already? And similarly, Marie Sivos, what about Luxembourg? And then Corinne Fleury has commented, it's really important to have all countries in Europe to compare education and doctors. And several people have been asking how to join. I think that was before, Alison, your last slide, which again shows people how to join. But picking up on these comments, Isabella, which are coming from all around Europe, how important is it, from your point of view, coordinating the EPAG to have more people from more countries within Europe and more diseases, and also the language barrier? How can that be worked around? What are your comments on that?
Yes, first it's very, very important to involve more people than possible, because as you know, in Europe is an entity a little bit complex. We have a different language, different healthcare system, different opportunity in the different Europe. One of the goals here is on ERN is really to achieve the goal to uniformalize, if it's possible, the opportunity of cure for each patient in each country. For this reason, it's very important to have involved different patients for the different country, because it's a unique system to understand a little bit more the problem for the single country. Second question is about the disease. We learn a lot about the different rare and complex epilepsy, but every day I am in touch with different patient organizations with different disease. It's very important for us to have an overview of the single disease, specific the ultra rare or the rare epilepsies that doesn't exist at the moment, an association. So the patient needs to try to involve and to create a network between them, because it's very fundamental to have a community together. So for this reason, really, I suggest all of you to be part of the community, because we need your opinion, your vision, your need for your disease, because the unique way to help you and to define some guideline how you can achieve the goal to have the same cure in your country. And we cannot solve all problems, sure, but we can give you the answer or what is needed to present in your country, and to have really a complete overview of the rare disease. And I want to add it only that the researcher and the big community need the help of the patients to go through and to play the attention of the single disease. So it's very, very fundamental to be the patient actively involved, also for the research and the European project and the registry to help the physician to collecting data and to create a community that support all activities.
And I think on the question of the language barrier, Alexis has mentioned on the chat again that maybe we should be focusing and asking for volunteers that are bilingual, and that helps obviously participation within the EPAG itself, but also may help with dissemination of materials and of information within the non-English speaking EU countries. And that ties in with a question that's just come through from Immaculada Magrana, asking, are the newsletters and the other media and resources available in other languages? I'm not sure I know the answer to that. Alison, can you help with that one?
Okay, so at the moment, obviously, we do write everything in English because we communicate in English, but it is something we're very aware of, that there's a huge part of the patient community that we're not reaching by doing that. There are plans to translate the patient information leaflets into other European languages. We will need resources to do this. So if there's anybody that can help out on these sorts of activities, then that would be absolutely fantastic. And in the same way, you know, as we start to send out the e-news, the emails, again, we obviously only represent a small number of countries. So, you know, we would need some support to be able to send those emails out in other languages. But if you could help us to do that, then we would welcome that support, because we would love to reach more people.
Right. I have two very specific questions here. I'll ask this first one. Sybil Craft Bellamy says this. She says, hello, I am the mother of a young man with Angelman syndrome, and I created a startup in partnership with French scientific and medical research centres. How can I share our projects and our studies to the community? Who wants to take that one? Isabella, is that one for you?
Yes, I think share information, because it's very, very important, because there are a lot of projects also external of ERN, and it's very important to communicate that, and if it's possible, to join the force with some specific goal. So I will suggest also, with the support of the physician involved in the research, to send a letter to our coordinator and to present the project and look if they need something, or if it's possible to find out a way how they can collaborate together to achieve in a quickly way the goal, or also to disseminate the project. I think it's something with a lot of value for our community.
Yeah, and I suppose another way, well, one way of sharing would be to join us. We don't have a representative of Angelman syndrome, and so that would be marvellous if you would have the time to join us. And another way, again, is, I'm assuming, yes, based in France. There are, I think, 3 EpiCARE centres in France. Alexis will correct me if I'm wrong. And so it may also be a good idea to approach those experts who are already part of EpiCARE, who can help coordinate and facilitate the sharing of research, because ultimately that's what this ERN is all about. Yes, Alexis says, yes, there's Paris, Lyon and Lille. So those are the 3 centres, but please think about joining us. And then I know someone's raised their hand, but just before we move to ask that person to ask their question, a question asked early on was from Helen Evans. What does Brexit mean for the UK participation? I could probably answer that, but Alison, do you want to take that one?
So it's got from a patient advocacy perspective, it actually doesn't make any real difference, or a very small amount of difference in terms of patient advocacy involvement in ERNs, because all of the work that we do is voluntary. We give our time voluntarily, so there is no reason why patient advocates from the UK cannot get involved, and there are actually 3 of us. Oh, correct me, 4 of us, sorry, I do correct me. There are 4 of us within our core EPAG representatives that in our group that are from the UK. So it would be very sad if it was almost diminished by half at the end of this year. From the ERN perspective, there is work ongoing to look at what impact generally a Brexit will have on UK centre participation being continued beyond the 31st of December. But from a patient advocacy perspective, there's no reason why we shouldn't continue to collaborate, put forward the voice and benefit from the information being shared. So I don't know, and Laura, do you see any barriers to that I haven't covered?
No, you're absolutely right, Alison. I think we, in terms of healthcare providers joining or being already in the network, we will see at the end of the year how things will evolve. And in terms of EPAG advocates in the network, as you said, I mean, we are still, of course, welcome to stay in the networks and even to join forces and to join the EPAG representatives who are already in the network. So everybody is, of course, welcome to join.
Right. So I think that somebody has their hand raised, and so we're going to move them directly to ask their question. If we can unmute. And Laura, is this you? I think we have Richard Porter's appeared on screen. I don't know if that's the question, but we need to unmute him to hear the question.
Yeah, I think that will be helpful to do it.
Lovely.
Richard, if you can hear us, could you please unmute yourself? Yes, there we go.
I think you're back on route, back on mute, Richard. If you could unmute yourself, and then we'll hear your question. Oh, okay. I think Richard's question has already been answered as part of this discussion. One thing that Alexis has said at the end, it may be controversial, I doubt it. He says it would be important to have more fathers involved with the EPAG to support the mothers. And it's right to say we have Jose, who is very relatively new to our group. And Jose, I think, is the first gentleman that we have had the privilege of working with. And he remains a rose amongst many, many thorns. So yes, I think that's right. I think we'd all like to have more a more diverse group, gender diverse, as well as diverse across the rare epilepsies and also across the European countries. Right, I think that's all the questions that I have taken a note of. If anyone wants any other questions answered, then please just put them in the chat and we will deal with them by email afterwards. Again, you'll have all of the slides, as we've said, so that you'll be able to see at your leisure how to join us. But I think that wraps up that Q&A session. So Isabella, can I pass back over to you for closing remarks?
Yes, I will thank you all participants. I will thank you, Alexis, for being with us today. I hope that with this information, more patients can join the group. For the next year, we have a lot to do, and we need really to achieve the goal to have more patients involved, more disease represented, because we will to take care to all rare and complex epilepsies, and we need the help of the patient, sure. So I hope that you can join in the future. Please don't hesitate if you have any question, any doubts. Alison, me, Emma, and Lo, Jose also are able to answer and to help you to be involved step by step in our community and maybe find the correct experience that you have to share in the correct working group. So thank you very much, and I hope we will hear and we'll be in touch very early with all of you. I would like to tell you have a good summer, and don't forget to take care of our children, our family in this particular moment, and don't forget to continue to maintain attention for our disease and our research project. Thank you very much. Thank you all. I will thank also Emma, Alison, and Laura for the great presentation. Thank you. Thank you very much. Good evening.
Thank you. Thank you, Isabella. Bye.
Bye.